Nearly 50% of adults in the US take daily supplements, yet most are unaware of how these could be impacting their glucose levels. If you're diabetic or pre-diabetic, the wrong choice in supplementation could spell trouble. Vitamins are essential for our bodies, but as a diabetic, your body doesn't process everything the same way a non-diabetic does. Some vitamins can interact with your medications, throw off blood sugar tests, or even cause spikes in glucose levels. And while deficiencies in certain nutrients can worsen your condition, excessive supplementation could lead to dangerous side effects. That's why today, we're breaking down 10 vitamins every diabetic needs to handle with care. By the end of this video, you'll have the tools to protect yourself from common supplementation mistakes while still reaping the benefits these nutrients offer. Before we dive into the details, do me a quick favor. If you've ever been confused about supplements or want more expert health advice tailored for diabetics, hit that like button, subscribe to the channel, and share this video with someone who needs it. Let's spread the knowledge and empower each other to live healthier lives. 1. Vitamin D. The sunshine vitamin is more than just a trendy health topic. For diabetics, it's a game changer in glucose metabolism and insulin function. But mismanaging your vitamin D intake can make controlling blood sugar levels a nightmare. Research from the National Institutes of Health, NIH, highlights that vitamin D plays a critical role in improving insulin sensitivity. It acts almost like a key, helping your body's cells unlock and use glucose properly. Without enough of it, your cells become resistant to insulin, leading to elevated blood sugar levels, a dangerous situation for anyone with diabetes. Studies consistently show that people with diabetes are more likely to have low vitamin D levels, often due to factors like reduced sun exposure, poor dietary intake, and even the effects of diabetes itself. But before you rush to load up on vitamin D supplements, consider this. Too much of a good thing can backfire. Excessive vitamin D can cause hypercalcemia, a condition where calcium builds up in your blood. According to the Mayo Clinic, this can lead to kidney stones, weaken your bones, and even impair insulin function, ironically making it harder to control your diabetes. What's the solution? Start with a blood test to check your levels. The NIH recommends maintaining levels between 20 to 50 nanograms per milliliter for most adults, but diabetics should aim for the middle of that range to avoid both deficiency and excess. Natural sources are a safer bet. Think fatty fish like salmon or fortified foods like milk and cereals. Sunlight can help too. Just 10 to 15 minutes a day can make a difference without risking skin damage. If your doctor suggests supplements, stick to the prescribed dosage. Avoid megadoses unless specifically directed by a healthcare professional. Vitamin D is essential for managing your diabetes, but risky when mishandled. By staying informed and proactive, you can use this vitamin to your advantage, without falling into the pitfalls of over- or underconsumption. 2. Vitamin K. Vitamin K is often associated with bone health and blood clotting, but it also plays a surprising role in glucose metabolism and insulin sensitivity. For diabetics, managing this vitamin is a balancing act. Too little can exacerbate complications, while too much may interfere with certain medications. Research from the Linus Pauling Institute highlights that vitamin K helps regulate insulin production and sensitivity, making it vital for blood sugar control. Studies have shown that people with higher vitamin K intake tend to have better glycemic control and a lower risk of developing type 2 diabetes. It's also crucial for maintaining bone health, which can be compromised by diabetes-related inflammation. However, here's where caution comes in. Vitamin K interacts with blood-thinning medications like warfarin, which many diabetics take to reduce their risk of heart disease or stroke. These medications work by slowing blood clot formation, and an excess of vitamin K can counteract their effects, potentially leading to dangerous complications. This doesn't mean you should avoid vitamin K altogether. It just means you need to manage your intake consistently. For diabetics not on blood-thinning medications, vitamin K from dietary sources is generally safe and beneficial. Foods like leafy greens, spinach, kale, broccoli, and Brussels sprouts are excellent choices. If you are on blood thinners, it's essential to maintain a steady intake of vitamin K-rich foods rather than drastically increasing or decreasing your consumption, as fluctuations can impact medication effectiveness. The recommended daily intake of vitamin K for most adults is 90 to 120 micrograms, which is easily achievable through a balanced diet. Supplements should only be used under the guidance of a healthcare provider, especially if you're managing other conditions alongside diabetes. Vitamin K is a powerful tool in supporting both glucose control and overall health for diabetics. By managing your intake carefully and consulting your doctor, you can reap its benefits while avoiding potential pitfalls. 3. Vitamin A. Vitamin A is essential for maintaining healthy vision, a strong immune system, and proper cell growth, all crucial for overall well-being. For diabetics, however, this vitamin presents a paradox. While it's necessary for certain body functions, excess vitamin A can disrupt insulin sensitivity and worsen blood sugar control. The connection between vitamin A and diabetes lies in its role in regulating the immune system and reducing inflammation. Research cited by WebMD highlights that vitamin A supports the pancreas, the organ responsible for insulin production. Inadequate levels can impair this process, making it harder to regulate blood sugar. Additionally, vitamin A plays a role in protecting the eyes, which is especially important for diabetics at risk for retinopathy, a condition that can lead to vision loss. However, too much vitamin A, especially from supplements or animal-based sources like liver, can lead to toxicity. This condition, known as hypervitaminosis A, is associated with symptoms like nausea, dizziness, and even liver damage. For diabetics, one of the most concerning effects of excessive vitamin A is its potential to induce insulin resistance, effectively counteracting the body's ability to use insulin efficiently. To safely incorporate vitamin A into your diet, focus on plant-based sources like carrots, sweet potatoes, and spinach, which contain beta-carotene, a precursor that your body converts to vitamin A as needed. This approach minimizes the risk of toxicity because the body regulates how much beta-carotene it converts. The recommended daily intake is 700 to 900 micrograms, RAE, for adults, and supplements should only be taken if prescribed by your doctor. Vitamin A is both a protector and a potential problem for diabetics. By focusing on natural food sources and avoiding oversupplementation, you can gain its benefits while steering clear of the risks. 4. Vitamin B12. When it comes to diabetes, nerve health is always a concern. Tingling, numbness, and even pain in your hands or feet, symptoms of diabetic neuropathy, can feel like constant reminders of a condition. That's where vitamin B12 comes into the picture. This vital nutrient supports nerve function, yet for diabetics, managing B12 levels is far from straightforward. The American Diabetes Association emphasizes the link between diabetes and B12 deficiency, particularly in people taking metformin, a common medication for type 2 diabetes. Research shows that long-term use of metformin can reduce the body's ability to absorb B12, leaving nearly 20 to 30% of diabetics on this medication at risk for deficiency. A lack of B12 doesn't just exacerbate nerve problems, it can mimic or worsen neuropathy symptoms, making it even harder to distinguish between diabetes-related issues and vitamin deficiencies. But while it's essential to prevent or address a deficiency, excessive supplementation can create its own set of challenges. High doses of vitamin B12, particularly when taken without medical guidance, can mask a folic acid deficiency, another condition that diabetics are prone to. This masking effect could delay necessary treatments, leading to severe complications over time. So, what's the best approach? Start by monitoring your B12 levels, especially if you're taking metformin or experiencing symptoms like fatigue, weakness, or tingling in your extremities. Blood tests can provide clarity. If supplementation is needed, work with your healthcare provider to determine the right dosage. Most people only need 2.4 micrograms per day, but diabetics may require more to address specific deficiencies. For food-based sources, focus on lean meats, fish, and dairy products. Fortified cereals are another excellent option, especially for vegetarians. But remember, more isn't always better. According to a study published in the Journal of the American Medical Association, unnecessary high doses of B12 can be wasteful at best and risky at worst. Vitamin B12 is like a lifeline for your nerves, but it needs to be managed with precision. With the right guidance and regular monitoring, you can harness its benefits without falling into the traps of deficiency or excess. 5. Biotin. Biotin, also known as vitamin B7, is often marketed as a beauty booster for hair and nails, but its benefits go far deeper. For diabetics, biotin plays a critical role in supporting metabolism and aiding glucose regulation. However, its impact on lab tests and potential risks from oversupplementation make it a nutrient that requires careful handling. Research from Medline Plus highlights that biotin helps the body convert food into energy by supporting enzymes involved in carbohydrate, fat, and protein metabolism. For diabetics, this means it may improve glucose utilization and even help stabilize blood sugar levels. In some small studies, biotin supplementation has been linked to improved fasting glucose levels, making it a promising option for better blood sugar control. But high doses of biotin, often found in supplements marketed for beauty benefits, can interfere with lab tests. According to the U.S. Food and Drug Administration, FDA, biotin can distort results for blood sugar levels, thyroid function tests, and even cardiac markers, leading to potentially dangerous misdiagnosis or inappropriate treatments. This risk is particularly concerning for diabetics who rely heavily on accurate lab tests for proper management. The good news is that biotin needs are relatively low. Most adults require just 30 micrograms per day, which can easily be met through a balanced diet that includes foods like eggs, nuts, seeds, and whole grains. Supplements should only be used under medical supervision, particularly if you're diabetic or undergoing frequent lab testing. Biotin is a valuable nutrient for diabetics when consumed in moderation and sourced from whole foods. By avoiding high-dose supplements and staying informed about its impact on lab tests, you can benefit from its metabolic support without running into complications. 6. Vitamin E. Vitamin E often gets attention for its reputation as a powerful antioxidant. It's like a shield for your cells, protecting them from oxidative stress, a condition that's especially problematic for people with diabetes. But before you stock up on supplements, it's important to know that vitamin E comes with some risks for diabetics, particularly when consumed in excess. For diabetics, oxidative stress is a constant battle. High blood sugar levels produce more free radicals, unstable molecules that damage cells and tissues. According to research cited by the Mayo Clinic, vitamin E helps neutralize these free radicals, reducing inflammation and protecting blood vessels from damage, a critical benefit, given the increased risk of cardiovascular disease in diabetics. However, there's a fine line between enough vitamin E and too much. Excessive intake, especially from supplements, can thin your blood, increasing the risk of bleeding complications. This is particularly concerning if you're already on blood-thinning medications, which are common for diabetics managing heart-related risks. Studies have also linked high doses of vitamin E, above 400 IU per day, to an increased risk of stroke, making it essential to approach supplementation with caution. The safest way to reap the benefits of vitamin E is through your diet. Nuts, seeds, spinach, and vegetable oils are excellent sources, providing the nutrient in a natural, balanced form. For most adults, the recommended daily intake is 15 milligrams, 22.4 IU, which can easily be met with a well-rounded diet. If you choose to take a supplement, stick to the dosage recommended by your healthcare provider and avoid megadoses unless specifically directed. Vitamin E is undeniably beneficial for diabetics, helping to combat oxidative stress and support heart health. But like many good things, moderation is key. Focus on whole food sources and consult your doctor before adding any supplements to your routine. 7. Vitamin C. Vitamin C is often hailed as the ultimate immune booster, but for diabetics, its role extends far beyond fighting colds. This essential vitamin has been shown to improve glycemic control and reduce complications associated with diabetes. However, there's a hidden side to vitamin C that every diabetic needs to be aware of. It can interfere with blood sugar management if not consumed wisely. Research from the Cleveland Clinic reveals that vitamin C acts as a potent antioxidant, protecting cells from damage caused by high blood sugar levels. It can also help reduce inflammation and lower the risk of complications like cardiovascular disease. In some studies, vitamin C supplementation has been linked to better fasting blood sugar levels and reduced HbA1c, the key marker for long-term glucose control. But high doses of vitamin C, over 1,000 milligrams per day, can distort blood sugar test results. Some glucose meters can mistake vitamin C for glucose, giving falsely high or low readings. This could lead to incorrect insulin dosing or other treatment adjustments, potentially putting your health at risk. For diabetics who rely on accurate readings to manage their condition, this is a serious concern. So, how can you safely include vitamin C in your routine? First, aim for natural sources like oranges, strawberries, bell peppers, guava, and broccoli, which provide the vitamin in balanced amounts. The recommended daily intake for adults is 75 to 90 milligrams, easily met with a diet rich in fruits and vegetables. If you're considering supplements, opt for low-dose options and discuss them with your healthcare provider to ensure they don't interfere with your blood sugar monitoring. Vitamin C is a powerful ally for diabetics when handled correctly. It can enhance your overall health and help manage complications, but excessive supplementation or carelessness with testing can create unnecessary hurdles. Stay mindful, and you'll make the most of this essential nutrient. 8. Folic acid. Folic acid, a form of vitamin B9, is a critical nutrient for everyone, but it's especially important for diabetics. Its primary role is supporting heart health and preventing complications like cardiovascular disease, which is one of the leading causes of death among people with diabetes. However, both deficiencies and excessive intake can present unique risks that diabetics need to manage carefully. The connection between folic acid and diabetes lies in its impact on homocysteine levels. High homocysteine is a marker for cardiovascular disease, and folic acid helps lower these levels, reducing the risk of heart attacks and strokes. According to Harvard Health Publishing, a lack of folic acid can worsen the already heightened cardiovascular risks faced by diabetics. But here's where things get complicated. Too much folic acid, typically from supplements, can mask a vitamin B12 deficiency, a condition that many diabetics are already prone to. Since both nutrients play crucial roles in nerve health, an undiagnosed B12 deficiency can lead to worsening neuropathy symptoms, such as tingling, numbness, and even irreversible nerve damage. To get the benefits of folic acid without the risks, focus on natural sources like leafy greens, spinach, kale, citrus fruits, beans, and fortified grains. The recommended daily intake is 400 micrograms for most adults, which is typically enough to support cardiovascular health. If supplementation is necessary, particularly during pregnancy or for specific medical conditions, consult your doctor to ensure balanced levels with vitamin B12. Folic acid is a vital ally in protecting your heart and managing diabetes complications, but like all vitamins, it must be consumed wisely. By prioritizing whole foods and working with your healthcare provider, you can safely incorporate it into your diabetes management plan. 9. Vitamin B6. Vitamin B6 might not grab headlines like some other nutrients, but don't underestimate its importance, especially if you're managing diabetes. This powerhouse vitamin plays a key role in glucose regulation and can even help reduce the risk of complications like neuropathy and cardiovascular issues. But as with all vitamins, balance is the key, and too much or too little can disrupt your health. For diabetics, vitamin B6 acts like a multitasking assistant. It helps regulate blood sugar by supporting enzymes involved in glucose metabolism. According to research from Harvard T.H. Chan School of Public Health, a deficiency in B6 is often linked to increased blood sugar levels, higher levels of inflammation, and oxidative stress. These factors can aggravate complications, including nerve damage and cardiovascular problems. But excessive intake of vitamin B6, especially from supplements, can lead to toxicity. High doses, often over 100 milligrams per day, have been shown to cause nerve damage, ironically mimicking the symptoms of diabetic neuropathy you're trying to avoid. Even though this type of toxicity is rare, it's a risk worth being aware of, particularly if you're taking multiple supplements. The best way to approach B6 is through food-first strategies. Great natural sources include poultry, fish, fortified cereals, bananas, and potatoes. These options provide the vitamin in its most bioavailable form, reducing the risk of oversupplementation. If a supplement is necessary, the recommended daily allowance for most adults is 1.3 to 1.7 milligrams, depending on age and gender. Diabetics should work closely with their healthcare provider to ensure they're in the safe zone. Vitamin B6 is a silent ally in managing diabetes. It supports healthy blood sugar levels and helps ward off complications, but only if handled correctly. Remember, it's not just about getting enough. It's about getting the right amount in a way that supports your unique health needs. 10. Niacin, vitamin B3. Niacin, or vitamin B3, is widely recognized for its ability to improve cholesterol levels, which is particularly appealing for diabetics at high risk of heart disease. However, this seemingly beneficial nutrient comes with a hidden drawback. In high doses, niacin can raise blood sugar levels, making it a challenging addition to a diabetic's health plan. The National Library of Medicine reports that niacin works by increasing good HDL cholesterol while lowering bad LDL cholesterol and triglycerides. This is a critical benefit for diabetics, who are more prone to cardiovascular issues. But here's the twist. Studies have shown that high doses of niacin, typically over 1,500 milligrams per day, can interfere with glucose metabolism. This happens because niacin reduces insulin sensitivity, leading to elevated blood sugar levels. For diabetics, this creates a delicate balancing act. While niacin can protect your heart, excessive intake may counteract efforts to keep blood sugar under control. In fact, some studies have observed an increase in HbA1c levels, a key marker of long-term glucose management, in diabetics using high-dose niacin therapy. To safely incorporate niacin into your routine, prioritize dietary sources like chicken, turkey, tuna, and fortified cereals. These provide the vitamin in moderate amounts without the risks associated with high-dose supplements. If niacin supplements are recommended for cholesterol management, work closely with your healthcare provider to monitor blood sugar levels and ensure the benefits outweigh the risks. Managing diabetes is a daily balancing act, and as we've seen, vitamins play a much bigger role in that journey than many realize. The wrong approach to supplementation can silently derail your progress, while the right strategy can empower you to live a healthier, more balanced life. From vitamin D, which supports insulin sensitivity but can lead to toxicity if overdone, to niacin, which helps with cholesterol but may spike blood sugar, every vitamin has its benefits and potential pitfalls. Knowing these risks is half the battle. It's not just about taking supplements. It's about understanding how these nutrients interact with your unique body and your diabetes management plan. Always consult your healthcare provider before starting or changing any supplement routine. They can guide you on whether you need supplements, how much to take, and how to monitor for any side effects. Remember, food-first strategies are usually the safest bet. A balanced diet rich in whole foods like leafy greens, fatty fish, eggs, nuts, and seeds often provides most of the nutrients you need without the risks associated with high-dose supplementation. Diabetes may demand vigilance, but it also gives you the opportunity to take charge of your health in ways others might overlook. Stay proactive, informed, and open to small adjustments that can make a big difference. Before we wrap up, let me ask, did any of these vitamin risks surprise you? Let us know in the comments, and don't forget to share this video with someone who could benefit from this knowledge. And if you haven't already, hit that like button and subscribe for more life-changing insights tailored for diabetics. Your health is in your hands, and every step you take today can lead to a brighter, healthier tomorrow. See you in our next video.